construct that financial education program, a clear prescriptive understanding of what education costs and how students can analyze that and consider their options.
All right, so we've heard the bill. Are there those that are here to speak in favor of the bill or in opposition to the bill? Any questions from committee members? Is there a motion on the bill? There's a motion and a second that the bill be reported as 1245. All those in favor say aye. Those no, the bill is reported. Okay, Senator Dunn, Senator Pike, Senator Stewart, as soon as we're done, you guys can get back up. Okay. Are you? Senator Dunn, do you need more time to work on your virtual bill?
I think the consensus is that in order to present both of these bills simultaneously, we need to request it passed by the week.
Perfect.
Do we get one more week?
Yes, you do. The concern is not so much about yours on timing, it's more about yours on timing because finance has got to see yours and I don't think they've got to see yours. So we will let both, without objection, go by for the day. Very good. So up next, there is the Stewart Pike Subcommittee. Guys, if you don't mind, I'd just like to be very clear about what the bill does, very clear, and then we're going to hear, we're going to have some raises of hands and the audience who's in favor and who's opposed, and we're going to take our paper. Senator Pike.
Thank you, Mr. Chairman. The amended bill before you would include the provision to allow CNAs, LPNs, and RNs and above medical licenses to reinsert the cannula for diabetic pumps.
Okay. Senator Stewart, that's it. All right, you feel good about that? All right, so those that are here that support the bill, will you raise your hand? And you understand, very good. All those that still have some concerns about the bill, would you raise your hand? The time was well spent. A couple of you still from the same concern you had before. Is that right? Okay, is there a motion on the bill as amended? Second. There's a motion that the bill be reported as amended. All those in favor say aye. Aye. Those no. Abstain. And one abstention. The bill is recommended reported as amended. Gentlemen, thank you. I know it's a little laborious, but I think it did the right way. Thank you, Mr. Chairman. All right, very good. Up next, we will go back to member bills. As here. Senator Locke, do you have a bill that we can hear? And then Barker, I think you have a bill that we can hear. I have a couple of them. Anyone else in the committee that is ready to go today? Okay, you are. Okay. Senator Locke, thank you for waiting, and we will pick up your bill.
Thank you, Mr. Chairman. I have Senate Bill 1424.
Okay, would you turn your attention to Senate Bill 1424?
And Mr. Chairman, Senate Bill 1424 provides that a woman seeking an abortion may waive in writing any requirement establishing a mandatory time period or mandate that a physician provide to or review with the woman specific information or materials before an abortion may be performed. The bill also requires that a copy of such waiver be maintained in the woman's medical records. The bill also provides that regardless of any waiver, a physician is still obligated to satisfy the applicable standard of care. And that's simply what the bill does.
Senator Lucas, thank you very much. That's our Senator Locke. Thank you very much. Those that are here, Senator Locke, I want to make sure it's really fair. Is 2 minutes okay? Would you like to do over? Okay. So those that are here to speak in favor of Senator Locke's bill, if we do that, just be careful with your time because we want to hear something from everyone, and we'll ask the same to the other side. So thank you and welcome.
Good morning. My name is Alex Littlebrand. I'm a resident of Arlington, Virginia, and I'm also a second-year medical student at Georgetown University. According to the American Medical Association's Code of Ethics, all patients have the right to make informed decisions about their medical care after a thorough discussion with their doctor. These rights extend to Virginia residents. The concept of informed consent comes from the basic rights of all patients to determine what's going to be done to their bodies. In contrast, informed consent does not include biased, state-mandated, non-medical information. Informed consent does not include unnecessary state-mandated waiting periods, and informed consent certainly doesn't include state-mandated additional imaging in the form of ultrasounds. When I'm a physician, the conversations that take place between me and my patients will focus on her medical needs. I will provide all the options to her in an unbiased, timely, non-judgmental manner, and only she will be able to give informed consent to any treatments that are best for her. These bills recognize that medically appropriate counseling does not include any of the aforementioned state mandates, and as a medical student, I believe my future patients deserve to make decisions about their own health care without interference from the state of Virginia.
Okay.
And Chairman Newman, I'd like to address you directly that I came all the way here from Georgetown today to speak, and there are many others here that came today even further, and it's a shame and an insult to the democratic process that they're not going to be able to speak today. Thank you.
Thanks for coming.
My name is Lindsay Paradiso, and I'm coming to you from Fredericksburg, Virginia, in support of the SB 1424 bill. I made the decision to end a very wanted pregnancy, and throughout the journey, I needed to know that the advice and services I received from my doctors were guided by their medical expertise and not by politicians. While there were health-related risks and issues involved in our decision to terminate, we were still making a very difficult choice. And I couldn't imagine having to make that choice under scrutiny by care providers who seemed judgmental or doubtful for my ability to make choices for myself and in the interest of my family. Thank you.
Thank you. So, if you just state your name and that you're here to support, that would be very, very helpful. Thank you.
Good morning. My name is Katie Gensch. I'm from Arlington, Virginia. I'm here in support of SB 1424. I'm going to read on behalf of Audrey Ford, who's also a resident of Arlington, Virginia.
Let me just say, I appreciate that and not be glad to accept responsibility, but we have this by agreement by the Republican side and the Democrat side. We have this by agreement with the patron of the bill that we're going to go through this. So we're going to make sure that we hear your support for the bill, but we're not going to blow through the clock. So if you want to state your support quickly, then we'll move to the next.
Sure, thank you. I'm testifying today in support of the bill SB 1424.
Thank you. Yes.
My name is Heidi Tingle. I'm from Arlington, Virginia, and I support this bill.
Perfect. Thank you. Come to that.
Anna Owens from Alexandria, Virginia, and I support the bill.
Perfect.
Walter, West Virginia, I support.
Perfect. Thank you. Come in.
Mr. Chairman, Emily Francis on behalf of Planned Parenthood and Planned Parenthood firmly supports this bill.
Perfect.
Good morning, my name is Jody Anthony. I'm the Executive Director of Mayor Approach, West Virginia. We support the bill.
My name is Nicole Graham. I'm from Alexandria, Virginia, and I support this bill.
My name is Gail Davey, and on behalf of the ACLU of Virginia, we support this bill.
Perfect. Thank you.
Good morning, my name is Margie Casilla with the NLRH Virginia Latina Advocacy Network, and we support this bill.
Thank you for coming.
My name is Kelly Gretsch. I'm a resident of Richmond, Virginia, and I'm here to support this bill.
Thanks for coming.
Hi, my name is Alejandra Pavlos, and I work with the Virginia Latina Advocacy Network, and I also support this bill.
Hi, my name is Irene Lynch. I'm with Mayor Approach, West Virginia, and I support this bill.
Thank you for coming today.
Good morning, my name is Judith Shamir. I'm from Vietnam, Virginia, and I support this bill.
Thank you.
Good morning, my name is Casey Chavez from Fairfax, Virginia, and I support this bill.
Good morning, my name is Allie Michelle, and I support this bill.
Thank you.
Hi, my name is Ashley Parker from Charlottesville, Virginia, and I support this bill.
I'm Marjorie Ruderman from Charlottesville, and I support this bill.
Thank you.
Catherine Long from Charlottesville, Evelyn Wells from Charlottesville, Virginia, and I support this bill.
Thank you, Tom.
Morning, Bonnie Wilson from Charlottesville, and I support this.
Good morning, I am Diego Rosso from San Borja, Peru, and I support this bill.
Thank you.
Good morning, I'm Jerry Young from Charlottesville, Virginia. I support this bill.
Good morning, my name is Jeanette. I'm from Henrico, and I support this bill.
Thank you.
My name is Caitlin Elmore, I'm from Virginia, and I support this bill.
Hello, I'm Tim Parker, I'm from Richmond, Virginia, and I support this bill.
Thanks. Yes, vote.
Hi, my name is Rodrigo Velasquez. I'm from Springfield, Virginia, and I support this bill.
Thank you.
Good morning, Dr. Vanessa Walker Harris, representing Virginia Department of Health, and for echoing the testimony previously provided. The administration supports this bill. Thank you.
Thank you. Very good. Are there those that are in opposition to the bill and for purpose at the 2-minute time or perfect agreement that we have for both sides? That'd be great.
Hi, I'm Victoria Cobb, president of the Family Foundation. We do oppose this bill. This law, as most of it, has been in place over a decade and worked very well. In addition, the concept of informed consent is throughout the entire medical arena, and there are great statements from the colleges and surgeons about why it's important. It's to build the doctor-patient relationship, it's to outline potential complications, and it's a litigation reducer. And I would just argue that in the case of abortion, it may be even more important than ever, because when women enter the abortion facility, in many cases, it's an unplanned situation. There's a moment of urgency and crisis, and emotions run high in that moment. So we strongly support informed consent.
Thanks, Victoria. Thank you. Mike?
Mr. Chairman, Joe Ray with the Virginia Catholic Conference, and we oppose this bill.
Thank you.
Louise Hart of Henrico County and representing Virginia Society for Human Life, and we oppose this bill.
Perfect. Okay, thank you. And are there members that have questions or have thoughts about the bill? Senator Donovan.
Yes, Mr. Chairman, thank you. I want to make sure I comment clearly as the one practitioner that is here today that informed consent is indeed alive and well in an unbiased way in doctors' offices everywhere across the Commonwealth. And patients always have the prerogative to decline any intervention, and that is something that is consistently done. The challenge here, so that you know, in this particular circumstance, is, and it is the challenge for other circumstances as well that involve a surgical procedure. When you proceed forward, you have to go to a site to perform any procedure, and that site can require that certain criteria are met before you can schedule that procedure. So the issue here is not at all informed consent. Patients are getting dutiful and very empathetic and appropriate informed consent across the Commonwealth. So I think that this bill is a little bit immaterial because informed consent is already in place.
Okay. Others on the committee that have thoughts here for or against the bill? Senator Locke, we'll let you kind of wrap up your thoughts and we'll go to the vote.
Thank you, Mr. Chairman. This bill is certainly not immaterial. What this bill would do is to give back to patients their rights to true informed consent, by allowing them to waive, women to waive non-medical, ideological, or medically unnecessary state requirements that are not intended to enhance informed consent. Thank you, Mr. Chairman.
Perfect. Thank you, Senator Locke, for helping us out. All right, is there a motion on the bill?
Move that the report.
Okay. Substitute motion. There's a motion second that the bill be reported, and there's a substitute motion. TBI. There's a substitute motion that the bill be TBI. The clerk will call the roll.
Senator Sasslaw?
No.
Senator Lucas? No. Senator Powell? No. Senator Locke?
No.
Senator Barker?
No.
Senator Black?
Yes.
Senator Carrico?
Yes, by proxy.
Senator Peterson?
No.
Senator Peterson?
No.
Senator Cosgrove?
Yes.
Senator Lewis?
No.
Senator Donovan?
Yes.
Senator Chase?
Yes.
do turn your attention back to 1452 related to marijuana, Senator Lucas.
Yes, so Mr. Chairman, this bill was, has been submitted at the request of a patient who was in need of these medical, marijuana for medical purposes. And what the bill does is provide an affirmative defense in a prosecution for possession of marijuana. If the marijuana is in the form of cannabis oil or THCA oil possessed pursuant to a valid written certification issued by a practitioner of medicine or osteopathy licensed by Board of Medicine for purposes of treating cancer or alleviating such patient's symptoms. The bill provides that a practitioner shall not be prosecuted for distribution of marijuana under the circumstances outlined in this bill. Under current law, only treatment of intractable epilepsy is covered by the affirmative defense. And all this does is add one more category, Mr. Chair.
Senator Lucas, is it correct that we had this bill, I think, last year?
I haven't seen it last
And
year.
we did pass it out last year.
Yes.
Senator Black.
Mr. Chairman, I would just point out, I did support the epilepsy bill and basically took the position that is as far as I'm going to go. I noticed that this covers cancer, which is a very broad area and one that, I think the medical profession handles very well without the need for marijuana. So I oppose the bill.
Let me just ask if there's anyone in the audience that would like to speak in favor or in opposition to the bill. Would you like to come forward and help us? Are you in favor of the bill? Okay. Anybody who's in favor of the bill, could you come forward and we'll just start our clock, which we have mutual agreement on, and then we'll go to those that are in opposition.
Thank you, Mr. Chairman. My name is Jen Michelle Bergini. I'm a resident of Chesterfield, and I'm a multiple lymphoma survivor and stem cell transplant survivor. I spoke to Senator Lucas's constituent this morning who is in another state receiving treatment and unable to, for sure, here to testify for some obvious reasons. Thank you for everyone's support on this legislation last year, and I hope we can continue to support this year.
Oh, thank you for coming today. Thank you very much.
Thank you.
Anyone else here to speak in favor of the bill, Mr. Lucas's bill? If not, those who have concerns about the bill, welcome. We'll start with one.
Good morning, I'm Regina Whitsett. I'm the Executive Director of SAFE, for Substance Abuse Prevention Coalition Chesterfield, and I also represent Community Coalitions of Virginia, which have coalitions across the state. And we are strongly in opposition of this bill for numerous reasons. First of all, there are alternative treatment options that already exist for cancer, and a report just came out from the National Academy of Sciences that indicates there is no or insufficient evidence that cannabinoids are an effective treatment for cancer. Additionally, as Senator Block mentioned, this would cover all 160 types of cancer, which would include skin cancer. And then also, these are not FDA-approved medicines, and while we think marijuana has some medicinal components, we think it should go through the FDA approval process like all of our other medications do. That is the only way to ensure proper dosage, patient safety about side effects, and drug interaction warning labels. Additionally, I just want to emphasize that all states that have legalized marijuana have begun with medical marijuana. Thank you.
Anyone else want to speak with concerns about Senator Lucas's bill? If not, does the committee have thoughts? Senator Donovan?
Yes, Mr. Chairman, and may I clarify, lines 17 through 19 are already existing code?
Yes.
So the point of this bill is to expand the allowable use for cannabidiol oil, which we already allow in Virginia to be compounded, from a single reason, which is epilepsy, to include cancer. There is not as much evidence as we would like on the effectiveness of cannabidiol oil because as a Schedule I medication, we're not allowed to do any research on it. But there is a lot of anecdotal information that many patients benefit from this, and I would suggest that the treatment of cancer is not a well-described set of variables. It's a confluence of a variety of different interventions to try and help a patient survive that with as much dignity and physical capacity as they can, because it's really hard. We're basically poisoning the patient to treat for cancer. So I would encourage that we consider expanding the use of the oils. I will also mention that we've passed legislation through the Senate that will allow cannabidiol oil to be rescheduled in Virginia because it is pending rescheduling by the FDA. So I would encourage us to consider this. This is reasonable. There are no hallucinogenic properties for the cannabidiol oil or the THC oil. So this is an appropriate expansion of an intervention that might really help people.
Are there other thoughts about the bill? Is there a motion on the bill? Senator Chase.
I just have a question.
Yes.
Whoever wants to answer this, knock themselves out. My question has to do with the consistency of the THC in the oil itself, because in my understanding, there's an inconsistency in the dosage.
So in the oil program that we drafted with the Board of Pharmacy this summer, there's certainly protocols in place to address dosing standards.
Did you have thoughts on that? We'll just do it real quickly and answer the questions.
Thank you for that question, Senator. It's actually a very good question. There's actually FDA warnings out right now that they're having a hard time measuring the potency and the consistency of the oils depending upon the manufacturer. And respectfully, Senator Donovan, these CBD, THCA oils are, for intractable epilepsy at least, are not more than 5%. And that can have an hallucinogenic effect, especially when it's heated and smoked, and it intensifies the potency.
Okay. Another question, Senator Chase?
I have a follow-up question. Whenever this is currently being distributed, the cannabidiol oil, is there any type of testing on batches that are given to the public as far as consistency?
Absolutely. Lab testing is required on all regulated products, and in other states it would be in place in this state as well. And to Regina's repeated statement about putting these chocolate mint flavor drops into a pen and somehow vaporizing and smoking it, the carrier oils have a very low combustion point. And to decarboxylate THCA, meaning to heat it up and make it become psychoactive, that heating point is far above the combustion point for these carrier oils. So perhaps, as we've discussed in the Board of Pharmacy Regulatory Advisory Panel multiple times, perhaps if after this device has exploded in your hand from combustion and you scraped out some residue, I don't know what patient is going to go through cancer diagnosis and treatment to bring in oils or to get oils from the dispensaries at some point and then to go through all this nonsense.
Very good. Other questions about the members? If not, is there a motion on the bill?
Move the report. Second.
All right, a motion and a second that the bill be reported. Clerk, call.
Senator Sasslaw? Senator Lucas? Aye. Senator Howe? Aye. Senator Lott? Aye. Senator Barker?
No.
Senator Black?
No.
Senator Carrico?
Abstain.
Senator Peterson?
Aye.
Senator Cosgrove?
Abstain.
Senator Lewis?
Aye.
Senator Donovan?
Aye.
Senator Chase?
Abstain.
Senator Sugarline?
Yes.
Senator Pease?
Yes.
Senator Newman? 10 yeas, 2 nays, 3 abstentions.
The bill reports, okay, up next, Senator Barker, you have legislation, and then I think I have a bill. We're getting closer to the end. I know caucus meetings are coming upon us.
Mr. Chair, I have two bills on the docket, one of which we have a substitute to agree on, I think, but we don't have the substitute prepared yet, so I would ask that on that one, which is 12.2, that go by for today. We do have a substitute for 10.20.
Would you like to go back today?
12.22, we can go by for today.
12.22, so without objection, 12.22
substitute for 1020. This is the one we discussed a little bit last week relating to peer recovery specialists and qualified mental health professionals. Basically what we have is a situation where we license certain providers, both in the health field but also in the mental health field, but then we have a lot of other people who are not licensed that are providing services, and this is very valuable services. There's also credentialing, accreditation, and board certification, and those types of things. So there are a lot of different types of ways to be able to get at the situation and to try to ensure that the services are being provided in a quality manner here. What is proposed in this bill is to create something that's a little bit different from that, and it's basically registration for people who meet certain qualifications. The two qualifications that are proposed to be covered here, one is peer recovery specialist. That's someone who's been through mental health or substance abuse issues and has certain experience and has certain training to be able to work with people who have that, those types of situations. In many instances, they can relate to them very well and are actually very well trusted by people and provide extraordinarily valuable services. The second is qualified mental health professionals, which includes people who have, you may have a master's degree in psychology, but because you don't have your PhD, you're not a licensed clinical psychologist. So it's some of those types of things. What is proposed here is that these people would be certified as a private entity that does the certification to make sure they meet all the qualifications. And then they would be able to register with the Board of Counseling as long as they were then paired with a licensed mental health professional. Part of the intent there is to get the professional, the licensed mental health professional working with the qualified mental health professional or the peer recovery specialist, and also to then be able to have Medicaid be able to provide reimbursement for those lesser, those unlicensed professionals, such as the peer recovery specialists and the qualified mental health professionals. And they only want to provide the reimbursement if they're paired with someone so there's oversight on the operation and everything. So that's basically what is proposed in this bill. It would not prohibit private insurance companies from picking this up later, but it was specifically to help us in this mental health situation as it relates to Medicaid, and actually we save money for Medicaid long term.
But there's a substitute. Are you okay with the substitute?
Yes, yes. Yes. I can move it out to the substitute.
Mr. Cosgrove's motion that we adopt the substitute is seconded. All those in favor of adopting the substitute say aye.
Aye.
Those no, the substitute is adopted. Okay. Are there those here that would like to speak in favor of Senator Barker's bill? Welcome.
Senator and members of the committee, this has been a joint effort with the Department of Health Professions, DMAS, and Department of Behavioral Health and Developmental Services. It's an effort to get some accountability in the system for those folks who are now working as peers or working as QMHPs, and it will provide, as I said, some accountability up front as well as at the end of the road. It does not change in any way the services they can provide or the qualifications that they currently need to have. Thank you.
Thank you for coming to testify. Are there others that would like to speak in favor of the bill? All right, there are those that have some concerns about the bill. Seeing none, is there discussion on the committee? There's a motion and second that substitute be reported. All those in favor say aye.
Aye.
Those no, substitute. Thank you for your comment. Any other committee members have anything else, or we, except for not those, are we basically there, or do we have anything else we need to clean up?
Welcome. Which bill are you looking at first?
Sir, it may be helpful if we take up Senate Bill 1100 first.
1100.
Mr. Chairman, Senate Bill 1100 is requested by the administration. It does require the State Council of Higher Education to do more reporting when it comes to our workforce credentialing program and grants. Mr. Chairman, as you can see, there are a number of items on lines 25 through 27. You request them to report back, but there is a request from the SHEV that we strike on if you would consider an amendment to take that portion out.
Okay, we have a motion second, all in favor of that, say aye.
Aye.
Nays? The amendment is laid.
So what's left, Mr. Chairman, is one that it will be an annual report, and it does include the wages and including the average wage and other relevant information that we provide to us on the non-credit workforce training programs.
Okay, thank you very much. Yes.
I asked Senator Newman, does this have to go to 5 years?
They've not asked for it.
All right, do we have, those who oppose the bill? And do we have those who support the bill? If you come forward, please.
Good morning, Mr. Chairman, members of the committee, Beverly Harrington, Chef. I just want to register my support for the bill. We're collecting data on the wages of the participants in this program, and we're ready to make the required report.
Okay, thank you very much. Next.
Mr. Chairman, Brett Massey, President and CEO of Virginia Manufacturers Association. I'm here in my capacity as chairman of the Performance and Accountability Committee of the Virginia Board of Workforce Development. This report will also come through the committee that I happen to chair. We are already halfway through the report. I can tell you that you will see good results from this, and it's an excellent bill, and we thank the patrons.
Thank you very much. Do we have any questions from members?
Mr. Chairman, I move to report as amended.
Second. Okay, we have a motion to report as amended. All in favor, say aye.
Aye.
Nay, likewise. The bill is reported.
Mr. Chairman, with your concurrence, I'd like to take up Senate Bill 1551.
All right, Senate Bill 1551.
Chairman, as most of you in this committee knows, and others in other parts of the Capitol know, that there has been a pretty strong effort from many of us, including the chairman and also Senator Howe and many others in regards to the training centers. We clearly have found out in the last year and a half or so that the training center closure is actually not required. The courts and Judge Gibney has indicated that that is a state of Virginia decision. It is not a DOE, Department of Justice issue. And so we, in this bill, seek to start the conversation about Central Virginia Training Center. We do know that by the year 2029, that we think that not all of the individuals be prepared to leave that facility, but it would allow for the substantial majority that will have to be able to work their way through that facility. So, Mr. Chairman, this bill simply states that we will go back to the Department of Justice, go back to the courts, and encourage them to keep this facility open until that day. I'd be glad to share with you the individuals that are in this facility. I think you've heard me on the floor a couple of times about that. These are the people that, in my opinion, I think God told us to take care of, and those people who cannot take care of themselves. And the best way to do that, in my opinion, is the way that the parents would like to do that. Mr. Chairman, with your permission and in accordance with the clock, I'd like for some of those that are in favor of the bill to have an opportunity to speak.
Yes, if you would please come forward. Just identify yourself, please.
I'm Lauren Ryan from Amherst, and I have twin sons who are 23, Taylor and Tyler, and they have been moved to Hiram Davis, and Hiram Davis is being represented as a training center to training center transfer. So they were moved on January 17th, and I had gotten a letter, a mandate letter through the acting commissioner that they must move. I did sign a consent for treatment after we arrived there, but I did not choose Hiram Davis because it is not the training center. And I will say that I appreciate the long years of the support of my family. Riley Wood was with me earlier today. He's here basically. He's Peggy Wood's father. He's a roommate next door at the training center. So what you're actually facing now is that 6 of the sickest are being singled out to go first. And we we may be the test case that my twins went first, sickest out first, is kind of a new policy. So I believe that two state citations are in play here, 37.2-837, right to refuse discharge from a training center, and also from Senator Neiman's 2014 work, comparable quality of care, which is chapter 639. So when I objectively, as a mother, as a registered nurse of 35 years, compare the ideal of Central Virginia Training Center, and then I go to Davis, there's no comparison. I've gone from the ideal to a real true hardship.
Thank you very much, and we have great sympathy for what you're going through. Yes, if you would, please.
With respect to the time limits, I'd like to just very quickly say, I'm Jane Cowell, President of the Central Virginia Training Center Families and Friends. The settlement agreement reviewer said in his December report to the court that the state lacks sufficient adult autism services and community providers for people with complex conditions, and these things will need some time to get into place. We are currently fighting in court, the commissioner and the department and people who have decided to